Welcome back to Meet the Experts. I am your host, Casey Pacheco. Well, thank you for joining. I just wanted to bring a little bit of an intention and bringing it back to center, bringing it back to ground of why I even am doing this show. I really believe that as healthcare nurses, doctors, the ones who provide healthcare, we have so much power in transforming healthcare. A really important way we can do that is by pairing up with some of the local nonprofit organizations within our community. So today, I wanted to do a special episode to shout out and spotlight in my local community a really amazing nonprofit organization called We Care of Central Florida. I have Lissette, the community engagement specialist here. Welcome, Lissette.
Hi, Casey.
Hello, welcome to the show. I am so happy to have you. I'm so happy to tell the community and the world what you do at We Care of Central Florida. So welcome.
Thank you. Thank you for having us.
Yes, yes. So just a quick, what is We Care of Central Florida? What do you do? Who do you serve?
Well, We Care of Central Florida is a nonprofit 501c3 organization, and we have been around over 25 years serving uninsured low-income residents of Polk County. And so our mission basically is to preserve lives and create a healthier community for Polk County's uninsured residents who are below 200% of the federal poverty level.
That is amazing. Thank you for the work that you do. Well, we know We Care has a lot of different projects, but we want to know a little bit about you. What made you connect with We Care? What made you get into this work?
Well, I was wanting to work. I was taking care of my grandson after being a third grade teacher. And so I went back to school working on my master's degree, and this position came open. And I applied, and because of my experience, I was hired. And it was a win-win. They were looking for someone to have that skill of outreach in the community. And I've had that experience. And so I applied and they hired me. And over a year later, it's just been win-win. We've been getting the word out, and wonderful staff. We have a staff of about 13 employees, to include my Chief Executive Officer, Heather Stevenson. And we're just a wonderful group, but we make a great big impact in Polk County as a whole, which there's the map behind me in Polk County.
Yeah, and I'm so excited to talk about what the impact that you guys bring. Thank you for sharing your story. So now I know We Care has a few projects. They have Project Pink, which is I think that's like really good for the women in the community. You want to tell us about some of the projects and offerings that you have?
Yes, of course. So Project Think Pink basically was let's see here. Project Think Pink, let me give you what we've done like last year.
Tell me what you did.
Basically, we delivered 625 essential mammograms and breast care services, and we empowered patients to basically take charge of their breast health. And we hold a fundraiser once a year to raise funds for this very critical project to support our uninsured residents in Polk County. And our compassionate volunteer specialty providers is what matters in all of this, because we could not do what we do without our volunteer healthcare providers in Polk County.
Wow. So you have medical staff that provide this care on a volunteer basis. Is that how it works?
Yes, ma'am. And basically, they're able to, we have specialty providers, and we have nurse practitioners, dentists, all specialty care. We have basically over 100 specialty physicians that
Mhm.
provide services on a volunteer basis in Polk County to support this program. And what's really amazing is, you know, they may not have time or basically to go to Peace Corps or Doctors Without Borders, you
Yeah.
know, but they're able to make such an impact in their own community, you know, to locally, by just seeing 1 to 2 patients per month. That's it. That's it.
Oh, wow. 1 to 2 patients. Wow. So how, if a doctor is listening in or a nurse practitioner, some specialist, and they want to provide their service, how would they get involved with your organization?
Well, basically, they would just contact We Care of Central Florida. Our website is
Mhm.
www.wecarecentralflorida.org. And basically, or they can email me, base or in online. There's the link on the website.
Mhm.
But basically, they're able to go ahead. Once I get their name, I can go ahead and do their application.
Mhm.
And once they sign it, I provide it to the county, and they send it to their legal department because, as volunteer healthcare providers under this program,
Mhm.
they are basically eligible to receive sovereign immunity for any patients they see under the program. They get 25% CME credit, and they're able to get their biannual license renewal waived.
Oh, is this for every healthcare professional or only the physicians? This is wonderful.
This is for the providers under the program that basically apply to the program. And then once I get the agreement back from the county, they look it over
Yeah.
and they sign it, and their or membership, if you will, is
Mhm.
good for 5 years.
Wow.
Yes.
This is wonderful. Now, are there any particular specialty um, doctors or providers that you guys are looking for, in need of, or have wait list patients to see?
Yes, yes, yes. Basically, podiatry, gastroenterology. We have pulmonology. Um, let's see here. We need. Um, we could always use gynecology. So
Okay.
all the specialties, but for the most part, those are the most used.
Okay.
And then, of course, with the need, it's growing as
Yeah.
far as what's needed. I mean, just today, our specialty care coordinator said she got 4 new patients to apply for services in one day. And that is just amazing. And that's just the specialty services side.
Yes. Do you only do specialty providers or do you also do like general care? Because I know there are several different programs here in Polk County. So do you only do the specialties?
We only do the specialty services, but we also have 3 other projects that provide services for our uninsured residents in Polk County. But basically, our specialty services, we have, goodness, We have diagnostics, and lab fees are also covered for the patient, which is really good. So, there's just a lot of benefits. We have our Project New site that covers a free exam and 2 eyeglasses for patients. We have our, let's see here, Project Ride to Health.
Yes,
For
the Right to Health. Tell us a little bit more about Right to Health.
Yes, the Project Right to Health basically gives our patients a free ride, and we have contracted through Uber Health to provide a free ride to our patients to their doctor's appointments. And AA meetings are also included in that, prescription services. And so, that's really good for our physicians because there are no missed appointments because of transportation. And Polk County is so rural. We need services like this. And it has been very, very beneficial. I have testimonies. Can I share?
Please share your testimonies. I love it.
Okay. So one testimony says, "We Care is a lifesaver, literally. Due to my economic and medical circumstances, I was able to obtain transportation to important medical appointments. Now that I have access to transportation, my health has significantly improved. We Care is knowledgeable regarding community resources and has filled several voids in my life, and I am sure countless others. I pray grants and funding continue and increase as We Care is my lifesaver."
That's beautiful. You
Isn't it?
you're really making an impact in the community. I have here, you guys did something like over 398 plus prescription glasses and over 15,000 rides.
Yes.
That's amazing. You
Thank
also distribute medical equipment?
Yes, and that's our project Helpful Hearts.
Oh,
And that
wow.
we provide durable medical equipment, basically like hospital beds and wheelchairs, assisting those that are facing mobility challenges due to physical disabilities, illnesses, and injuries.
Wow. So if someone in there from the community, they're looking on and they're like, I need these services. How would I get hold of you? How will I qualify? Do they have to meet the federal poverty level, or do you have certain guidelines for them in the community?
We do. If they all they need to do is go on our website
Mhm.
at and there's the application is on there, because we Care of Central Florida we have grants as well, but we're primarily funded by the half-cent sales tax that is incurred for funding free clinics, and so we have a portion of that for the specialty services. And in addition, with grants that we have applied for to continue, like Project Think Pink for the mammograms. And that's why we're doing a fundraiser, because we need those critical funds to keep the program going. So Project Helpful Hearts, but basically the patient, all they do is go on our website at www.wecarecentralflorida.org. And they go ahead and do their application. And if there's anything missing, we have our patient intake employees that go ahead and look everything over. And if there's anything missing, they contact the patient to provide whatever is needed, to provide that documentation that's needed for, finalizing their application. But it's simple, and we have such a helpful staff that you can hear the heart through their voices. We have a wonderful, wonderful staff.
That's amazing. And I am so grateful that you all are doing this work for our community. Now, I have a couple more questions for you, just for the viewers listening in. Do
Okay.
you have to be a resident of Polk County to get to be involved? Is it because of the tax situation you have to be here, living here in Polk County?
Yes, ma'am. There, you have to be a Polk County resident
Now,
primarily to qualify first.
do you have to be a resident of Polk County to be a provider, or do you accept providers from surrounding areas?
Well, the state of Florida does offer the volunteer healthcare provider program for all of the state. So
Okay,
our specialty though here is Polk County, and that's what area I cover.
okay.
So you're able, if you're outside of Polk County, it's available to you too. So you just need to go to basically the website, and the providers have that where they get their licensing, and they can find out information about the volunteer healthcare provider program.
Absolutely. Well, this is wonderful. This is wonderful work that you're doing in our community. I have a question for you. Um, so now for our listeners, I know you said you're going to go to school. Are you getting into healthcare yourself?
Oh my goodness. Well, I have actually I have 15 years experience in healthcare administration.
Wow.
I just decided to go back to school because of life transitions when we moved here to finish my degree, my graduate degree, and I'm 2 classes from finishing uh, in healthcare administration. So I'm super excited. It's been, a journey working and going to school, but it's good. I have learned so much, and I continue to. So it's just my passion is just to give back and to help the community and serving. That is just so important.
Well, the reason I asked you is because the name of the show is called Meet the Expert. And when we term you expert, it's expert through experience. So you are out here, you're almost there, you're almost finished with your master's, but you are out here really working hard in behalf of our community. So you are a community expert, and we are so grateful to have you.
Thank you. Thank
Yes.
you.
Now, do you have any words of advice, any words of wisdom, guidance, or support for anybody who might be looking on this interview today?
Well, support for them personally or professionally.
Whichever one you feel, whichever one is.
Okay.
Yes.
Okay. Well, if I could, I like the question that is shared. One piece of advice with my younger self, what would it be and why?
Mhm.
Um, is school's never out for the pro. Education, I believe, stirs up your potential, and so I've always been in a learning and doing, not just learning, so that is what I would like to share, and also always having an attitude of gratitude.
Mhm.
My mantra.
Love it.
My mantra on LinkedIn is positivity always wins.
Yes, I love it. It does.
Yes,
It
yes, yes.
does.
So that is just, yeah, that's so important.
So you're doing all this beautiful work here at We Care Florida. Some people are looking and they were like, wow, I did not know this existed in the community. Maybe some organizations may want to meet with you for collaboration and connection.
Yeah.
What about those who say, man, I want to give, I want to be part of this, I want to give some funds or donate my time or help spread awareness? What are the different ways people could give to We Care of Central Florida?
Oh my goodness. Thank you for that question. I have on, or basically we have on our website is donation that they can go various methods of donation if they wanted to donate. We try to do community outreach events. Like this past weekend, we were just at Lakeland's Farmers Market. And we had a booth there. And so we were giving out community information packets. And we were offering free reading glasses. So there were residents that got free reading glasses and information. But basically, it's just to give exposure to what's available, because my thinking has always been, you may not need these services, but you may know someone, you may run into someone, have a family or friend who could benefit, that you can pass the information on for us and help us. It's word of mouth, advertisement through word of mouth and sharing. And so that's what we did. And we impacted just on Saturday over 202 actually residents that we gave out information to at the Lakeland Farmers Market. So we try to do, community events, get out to food pantries, to also get out we have an Adopt a Block organization in Lakeland that we're going to be having a few minutes to share. So for the residents to get the word out as well. And so it's just letting people know about the information. And so we're happy to share. So if there's, events that people may have that they have upcoming, that they would like to invite us to, we can also, we can see what we have on the schedule and see as far as availability, and definitely, participate to give that information out to the community.
Absolutely. Absolutely. Well, this is wonderful. I'm so glad to have you on. Our show on LinkedIn. It also airs on Facebook. So this is definitely really good to get the word out. So listeners, viewers, if you live in the Central Florida area, Polk County, and you're seeing this and you didn't know about this service, be sure to share. But I don't want to just limit it only to the people living here, because where we are in Polk County, our county is one of the fastest growing counties in Florida, and we touch so many different surrounding counties. So maybe someone doesn't live here, but they know of someone here, or they have a parent that lives here that could benefit from your services, or would like to support We Care of Central Florida. So we just put it out there. But I so thank you for joining me today. I thank you for your very, very beautiful advice. I don't know if you have the vision of We Care Central Florida, but does your organization plan to expand? Because I know a lot of places probably wanting to have these services as well. Do you have expansion goals?
Oh, expansion would be wonderful. Of course, we would just need to. I would have to talk to my boss.
Yes.
But our vision. Let me share our vision. Our vision is for all basically Polk County residents to have access to high quality specialty medical care in order to preserve lives and create a healthier community. And that's our vision.
That's a beautiful, beautiful vision. I see that with you. And I thank you so much for your time. Thank you for letting me pick your brain. Audience, you may have some questions of your own. Please leave it in the comments below, and I'll be sure to get it back to Lissette. Thank you, Lissette. Thank you for all the work that you and your team do at We Care of Central Florida. And I will see you next time.
Thank you, Casey. Bye.
Bye.